This is Arctic. He's our gyrfalcon. Gyrfalcons are the largest species of falcon in the world. He's a 24-year-old bird. We got him when he was 19 years old and starting to develop arthritis.
Arctic was in very bad shape. Arctic wouldn't even stand, had to lay down, and so Arctic wouldn't even use his feet. It was so painful. Birds of prey don't live very long. Probably have a lifespan of 8, maybe 10 years. In captivity, they can go 20, but by going 20, they've lived well beyond the age they would ever live in the wild, and so Arctic just started being a heavy winged falcon, which gyrfalcons are. All that weight on their feet and sitting on perches and not flying all the time created arthritis.
He had so much difficulty because of the arthritic condition of his feet, didn't tolerate medications very well, not a whole lot of options to look at what we could do to really make him more comfortable.
Once we took x-rays, basically the joints in all of Arctic's phalanges or toe bones looked like broken glass. It looked like just a couple of sacks of broken glass instead of nice, smooth, clean bones and joints. And I wasn't sure that we'd have any chance at all.
So we had to do something to break the cycle, and that is the use of the laser to kind of decrease his pain, promote him to increase his activities, better position him with the various modalities and the uses of the foam rollers that we have, that sort of thing, to just get him to be and act natural. Hey guys, how you doing?
Good to see you.
Good seeing you.
We decided that the laser therapy and physical therapy was a good option for Arctic.
Laser has been around for about 15 years. It's a great adjunct to what we do in physical therapy because it's all about trying to restore function. And by eliminating pain, we can kind of get the animals to typically get back to their normal course of action and promote their healing and that sort of thing.
We chose to do the laser therapy over a medication just because in a bird, medications are hardly tolerated. With a laser therapy, there's no pain involved, there's no side effect that could come and injure a bird even more. There's really nothing that could happen to do any more damage, say like a medication might down the road either affect their kidneys or their liver and drop their immune system, which we have seen in captive birds.
Well, in raptors, I've been using the laser for probably 6 or 7 years. We're able to get the photon to 6 to 7 centimeters deep in infrared. So we've created an effect on the cell that's very positive without any downside, and it's really literally increasing healing by 30% and causing a lot of surgical cases to be non-surgical. It's one of the most incredible technologies to come along in medicine.
I think there's a lot of education that has to be done throughout the vet world and the vet practice about the proper application of laser because it's an extremely beneficial tool, but the tool's only as good as the person who's applying it. A laser is just like application of a medication. You need to know the dosage and you need to apply it correctly, and with that is all about the education and understanding the best use of the laser.
So typically when we go in for a treatment, what we do is we'll bring Arctic in and get him out and get him looking at the laser, the wand that they use so he gets an idea of what's going to be touching him. They'll turn on the laser and they move from his feet, up his legs, all the way up to his hips and down his spine. And you can tell that he starts to like it. The physical therapist will stretch out his talons as well and will come up with a method for us to work with Arctic at our facility as well. So either using the physical therapy bands to get him to stretch, or using a foam roller to get his feet to stretch out by pulling on his talons, working him early in the morning, working him in the evening, working him in the middle of the day to try to get muscles and joints working and creating a good blood flow.
There you go. See you in about a week.
Thanks so much.
Okay, bye-bye.
The reaction to laser therapy was pretty immediate. We did 6 sessions, so 6 days straight in a row for maybe about 5 minutes each day. And you could tell a difference immediately. He started being more mobile, he's moving around, he's getting up out of his nest in the morning and going up to his perch without having to sit there with his feet crumpled up and looking just miserable. So it actually worked within a week. We saw a totally different bird.
He's a perfect example of how the laser not only makes arthritis feel better, it actually causes some of the joints to heal and become younger.
This is where laser, I think, could be a huge benefit to the bird world, just because of their the benefits of the modality and the lack of complications from the treatment.
The therapy itself, since it has no side effects, can really help to do much better for these birds in captivity, since we want them to keep working with us and being around for us to teach others about them and for being companions.
This is a great option for the birds that should not be underestimated.
Anyone today who has a practice that you want to give a high-end technology, the infrared laser is probably one of the best tools that we have. We use it, what, 20 times, 30 times a week, 40 times a week. We have a laser therapist we just hired on full-time just to do laser therapy. It's that good.
I would definitely recommend using therapy, physical therapy and laser therapy, just to work on birds that are older or birds that even have a wing condition, a leg condition, anything. I feel like the cell growth and the cell movement and just the blood flow and circulation that we could get through this therapy could help with so many other ailments besides arthritis in an older bird.
I've done this 38 years. It's one of the few technologies I've seen that actually exceeds what it was even billed for.